people with multiple health conditions such as COVID, diabetes, heart issues, kidney health issues, and women's health issues through a very able and experienced team that is in-house at Xyla for the highest quality care. So, as you all know, November, as you all know, is specifically denoted to men and focuses on men's health. Here we are today on this platform to understand that what are the issues and what are the problems faced by men, wherein we can provide them a safe space to openly discuss their mental and physical health problems without the fear of any stigma or any judgment. So here we are today to discuss the issues that men face in the physical health domain, in their mental health domain, and what can we do as a part of the society to prevent it or manage it. And for this, we have with us Dr. Manvi. Dr. Manvi Mukherjee is a part of our senior doctor panel who is actively working with patients to improve their health on a daily basis. So over to you, Dr. Manvi, to take this webinar forward without any delay. Thank you so much.
Thank you, Sangha. Good evening. Hello. And today we are going to talk about a very important topic, which often gets overlooked because men have these notions and societal foundations where they think they have to be healthy and stronger than everyone else most of the time. And due to that, we overlook so many diseases. And today we are going to talk about the most common of those diseases and make sure that you are equipped to not overlook them. Let me just tell you a bit of a background and facts so that you know why men are more likely to overlook and how important this topic is right now. Because they are more prone to lifestyle diseases in their 30s. They are half as likely to go to doctors for physical examination as compared to women. Also, the mortality rate is higher in men. Their life expectancy is lower in men. And since the corporate population lives a very sedentary lifestyle, and more than 65% of corporate employees are men, they are more at risk of developing lifestyle diseases like diabetes, hypertension, cardiovascular diseases. Also, addiction, be it for tobacco, cigarette, alcohol, all of this is more common in men and thereby exposes them to a wide range of diseases that are less common in women. Sangha, could you please change the slide? Men are also, not only are they troubled by the diseases that can affect everybody, like be it stroke or heart diseases or diabetes, but they also have unique diseases that affect only them. And most common of them are prostate cancer and benign prostate hyperplasia that we will be talking about, and what are the signs that you must not miss. Today, we'll talk about that today. Firstly, the first disease that we'll begin it with will be the cardiovascular diseases, which is the leading cause of death in men. And most importantly, it goes overlooked, or people forget to take medications, or more likely they forget to get tested for it. 1 in 3 adult men have some sort of cardiovascular disease, be it atherosclerosis because of the high cholesterol levels that they have, or hypertension because of the severe stress levels, or just sedentary lifestyle, and stroke because of both of these actually. Hypertension and stroke are most common actually not most common, very, very common in men under 45, and equally common, if not more, in above 45 also. So, and cardiovascular diseases can be managed. They can be managed very well, where all you have to do is maintain a healthy lifestyle. You have to eat healthy and exercise regularly. And that can reduce your mortality and increase your life expectancy by so much. Please go to the next slide. Cancer. Cancer is the second leading cause of death in men after heart disease. And it is more so because men in India, be it rural, be it urban, are so used to either chewing tobacco or smoking cigarettes, which increases their exposure to carcinogens. Except for there is an occupational hazard for men who are working in dye industries, who are working in factories and mines, and pollution for that matter. All of this exposes our body to so many carcinogens, and men do not seek help in time and end up having cancers that can be completely cured if caught on time, like prostate cancer, colon cancers that can be easily caught if a regular colonoscopy is done, and can be treated, and it is non-fatal if caught on time. But the main importance of this webinar basically is to make you aware that there are these very common and diseases that are just overlooked because we do not get tested on time, do not get aware of them on time. So next, please. Okay, prostate cancer. This is very common in men. In fact, it is the third most common cancer in Indian men. The incidence is expected to increase, and the symptoms are such that everybody just dismisses it by saying that it's old age because it involves not this feeling of incomplete passing of urine, and there is dribbling, and there's increased frequency of urination, and people just feel that it is age ho raha hai, so they are having issue in controlling their urine. Sometimes there might be blood involved, but that is when people come to the doctor, right? They don't come to the doctor when they have an issue with urination, or they are just having trouble urinating or having trouble controlling their urine. And prostate cancer can be easily detective. There is a blood test that can help in detection of prostate cancer. There's a physical examination, and all you have to do is visit your doctor once every year, at least after you're an adult. It is less common in men under 50, but it can still be diagnosed if people just got tested once in a while. Less than 1% men under 50 get tested, and they are not and doctors are not able to diagnose because they were never tested. The good thing is that men over 65 do get diagnosed pretty often. At least 6 out of 10 do get diagnosed, but it is found in younger men also, and they must keep an eye out for symptoms resembling prostate cancer. Next, we're going to talk about benign prostatic hyperplasia, that is BPH. And as the name suggests, it is not cancerous. But as soon as people hear of this, that okay, so it is not cancerous, let us not worry about it. The symptoms are very similar to prostate cancer, and people can actually have both of them together. So it is not one of those where you're like, okay, so we are safe because it is not cancer. No, you need to get help because again, you're going to have difficulty in urination, and that is going to affect all the systems of your body. So BPH affects 50% of men over the age of 50 and about 90% of men over the age of 80. And it is a very small procedure that is done by doctors. If medicine cannot control your BPH, it is a very small procedure, and that takes care of your problem for at least a few years to come. But people, since they don't visit the doctor or do not take it seriously, often are not able to diagnose BPH. The symptoms for BPH that you must keep in mind, and if you have issues, go to a doctor, is again dribbling of urine. That is, after you have finished urination, drops of urine may still be falling, and you're not able to control that. Also, you may have this incomplete sense of urination after urinating, but still keep having the urge to go. So these are few small symptoms that if you ever encounter, even once or twice, and then you think, okay, this is under control now, please go visit a doctor. It is a very simple physical examination that will help you know that whether you have it or not. Please go to the next slide. Okay, diabetes. I cannot stress this enough that if somebody in your family has diabetes, if your weight BMI is above 25, or you're in the higher weight range, you feel that you're overweight or obese, if you lead a very sedentary life or your food habits are not healthy, you must get tested for diabetes at least once a year. At least once a year. Men are more susceptible to type 2 diabetes as compared to women, especially the 35 to 54 years of age group. They have higher stress levels and more sedentary lifestyle, and usually not enough time to work out. So if left untreated, diabetes is very, very harmful and very, very bad for your body. It has all sorts of complications that involve your kidneys, that involve your eyes, that involve your nerves. So instead of letting it progress to that level, make sure you start living a healthy life today. And in case you have any symptom that resembles diabetes, like increased thirst or increased hunger, increased urination, or some tingling in your nerves or something like that, make sure you visit a doctor and get their advice. Get at least once tested for diabetes once a year, and it will solve and make sure you do not have a lot of problems once you get older. Um, Okay, this is another thing that people don't like talking about, erectile dysfunction. And yet it affects almost two-thirds of men over the age of 70, and almost 39% of men under the age of 40. So this is a very common uh, disorder that people have, a dysfunction that people may have, and they do not like talking about it. And the thing is, the most common cause of erectile dysfunction is atherosclerosis, which is also the cause of heart attack, of stroke, of plenty of cardiovascular diseases. So, men who have erectile dysfunction need to get tested for diabetes, because diabetes could also cause this, for atherosclerosis and other cardiovascular diseases, and low testosterone, and a variety of investigations must be done so that they know that why they have erectile dysfunction, and it can be treated. It is not something to be just ashamed about and let it negatively affect your sex drive. It is better to find out the cause, get to the end of it, and live a healthier life, not only in the bedroom but also outside, because you'll be living a healthier life if you are less likely to get a heart attack, or if your cholesterol levels are in the normal range. So if you ever have a problem like this, make sure you visit a doctor. Make sure you know how your why it happened and how you can cure it, manage it. Sangha, please go forward. Okay, so we have talked about various physical illnesses that affect men. We talked about prostate, we talked about diabetes, we talked about cardiovascular diseases, and few very, very simple things that you can do to take care of your physical health can actually be counted on your fingers. Because it is so simple that you need to get an annual health checkup done regularly. Don't wait till you're 50. Don't wait till some disease comes along. Just get one checkup done annually. You can get it done in the community health screenings, or if your employer has health benefits offering, so you can get them done. You need to lead a healthier lifestyle, as in working out or even walking 30 minutes a day. Eating healthier as in less carbs, less oily stuff, and a little more of fruits and vegetables, the freshness. And you can actually be in the better part of the statistics, because almost half of the premature deaths among men is preventable. So if you take these actions from today, you'll make sure that you live longer and are in the better part of the statistics. Know your numbers. Always know your numbers. Know your cholesterol levels. Know your glucose levels, especially if you have a higher BMI. Know your other vitals, so that if someday you go to a doctor and they tell you your blood pressure is something, you know whether it is in the normal range or not. And for example, for diabetes, there is a range of sugar level in your blood where it is a pre-diabetic condition. That is, you do not need medicines to control that. But if you don't do anything about it, then you may become diabetic. So knowing your numbers will enable you to have the power over this, and you'll be able to take care of yourself better and manage your conditions better. So make sure you do regular screening for your physical health at least once a year. And once we have talked about physical health, we'll be moving to the mental health aspects of men. Since it is, oh, okay. Let me tell you more about the physical health aspects, like the lifestyle medications and the routine medical checkups. When I told you to eat healthy, I meant eating a balanced diet. like with fruits and vegetables. Make sure you quit smoking, not drink, or if you have to drink, in moderation. Take medications as and when required and in the dosage that was prescribed to you by the practitioner. Follow very simple steps. Like, for example, skin cancer, all you need to do is apply sunscreen regularly. If you have a higher weight, then just remember to exercise regularly, to eat healthier, and all of this will be really helpful for managing your physical health. Let's move on, please. Okay, so now we come to men and mental health. And the thing is, all studies have found that depression in men can go unnoticed because men are not comfortable in revealing mental health issues, because their symptoms don't always match what we read as textbook cases of depression. Often men experience depression as anger or irritability, or just what may come off as them being aggressive rather than sadness. And when it comes to mental health issues like anxiety and depression, men are also reluctant to seek help because they think it is a more women common thing, or that they seem weak. A lot of men feel that mental health issues, if they have them, then they are weak. But that is not true. That is not true, because mental health issues can affect anybody. And what you need to do is go out to the doctor, talk about it, get help from a psychologist, get help from a psychotherapist. If needed, get medications. But be healthy, because your mental health is equally important. If you had a physical condition, you would have gone to a doctor. Then why not visit the doctor for a mental issue? Sangha, please, let's. Mental health and stereotypes. Stereotypes not only bar men from speaking to their loved ones about this or to their family about this, but often they do not agree about it to themselves. They don't believe this, that men can cry, or that I can have depression, because for them, depression is for the weak and men are not weak. We have seen countless stand-up comedies about this, about people going on and saying ki how men are so strong and dard nahi hota, they don't feel pain or sadness. But men need to be able to show emotions, because it is not a sign of weakness, as contrary to what the society would like you believing. So this self stigma that is present in men, accompanied with the societal pressures and the societal stigma that already exists, and even in workplaces where they are worried that people will judge them or not find them as capable as their non mental health issue counterpart. All of this makes it difficult for men to come out and talk about their mental health issues, or get make it difficult for them to get help that they require. Sangha, please, next slide. So let's talk about mental health in workplace, how it can be identified and what can be done for it. We need to train managers about mental health so that they are well equipped to handle people who are expressing mental stress at work. Instead of calling it a breakdown, or calling it that they are freaking out, it would be so much more beneficial if they could just have a dialogue about it and improve the communication, active listening. People need to be trained in active listening so that they can interact with their employees better and can handle the mental health issues in the workplace better. We need to improve mental health awareness and reduce the stigma that is present around mental health. Organize these psychosocial interventions like leisure based activities, team building activities, physical stuff to do. A lot of corporate setups, workplaces are now adapting and having these leisure rooms where there is games to play, where people can just cool down in their time of leisure and make sure that they are not very stressed. And there should also be dedicated counseling and mental health support for the employees who might need it. Um, so what we need in a workplace is a more empathic workplace where managers are well equipped to handle people who have stressed, who have mental health issues. And if they do find that somebody needs dedicated counseling, healthcare support, then they should have that available to their discretion, that if needed, people can use it for them. This way we can, and since 65% of corporate employees are men, this will immensely impact men's mental health. Another very important thing to remember is that your emotional health impacts your physical health a lot, and vice versa. If you're emotionally healthy, you're more likely to get up from your bed, work, socialize, and go through your daily life. But your physical health is equally important too. If you do get up early in the morning, or whenever you do get up, and get 20 to 30 minutes of exercise, some exercise per day, it actually does marvels for your brain. The circulation helps so much. You release more endorphins, you're happier in the coming time. It also makes time for you to socialize with your friends, engage in hobbies. A very important thing what helps people is setting realistic goals for every day and prioritizing what needs to be done. Make sure you give yourself time, that you're patient with yourself. If you feel sad today, it is okay to give yourself a day to deal with it. Be patient, give yourself the time to deal with it, but then create realistic goals that you can come out of it. But most importantly, if you feel that you are in a slump, that you need to get help, you have been sad for very long or angry for very long, because that is very common in men, or irritated for very long, please get help. All you need to do is talk to a professional. Talk to a professional. If you do not want medication, convey their needs, but don't shy away from it. Do not ignore the problem. Do not overlook it. So that is what needed to be covered today. And if you have any questions, please ask in the chat box, or you can contact Xyla Health anytime. Thank you.
Thank you so much, Dr. Manvi, for making us understand that why men's health should also be prioritized, and how we can, actively take steps to make sure that men's physical and mental health both are taken care of. Uh, Anyone has any questions? You can unmute yourself and ask your questions if there is any. आपके कोई भी सवाल है तो आप अपने आप को अनम्यूट करके पूछ सकते हैं. Okay, so Dr. Manvi, we will take very few commonly asked questions that we have related to men's specific health. We usually talk about how men can support women specifically in their health issues. Now, we as women, what we can do to make sure that men take active approach in their physical as well as mental health.
One of the most easiest thing that we as women can do is that when we plan going for an annual checkup once a year, we make sure that we take the men we know, our loved ones, along with us. One single checkup, a full body checkup annually, can reduce your problems by half, if not more. Another thing that we can do is we can encourage them to eat better and talk to us. Of course, we can encourage them to do all the other things, that eat better, go exercise, take care of your health. All of that is obviously present, but make sure you're talking to men around you and giving them a safe space for them to come out to you, for them to talk about what is going on in their head, get angry and maybe sad in front of you, so that once you have made it a safe space where they can actually convey what is going on in their brain, then you can actually help them take the next step, that okay, if they do need to go to a doctor, then they are open and accepting about it.
Absolutely. Thank you so much, Dr. Manvi. In your practice, Dr. Manvi, how often have you seen that men, make an active visit to the doctor or to the hospital or the clinic to keep a check on their health? Have you found out something on that front?
Yeah, this is actually a very interesting observation I have. In the urban areas of India, men are still likely to come to a doctor when they have physical pain. Okay, so my throat was paining, I've come to visit. But while I was working in the rural sector, women there come to the hospital for anything. I have had patients come to them because they found a new, and their skin is getting more pigmented, or they have pimples or something. But men will come to you, men in the rural India especially, will come to you when there is absolutely nothing they can do on their own, which means they may have got hurt and an ulcer is now present on their legs, and they have tried everything that they know they could have done, cleaning and using turmeric and oil and whatever they understand, even medications for that matter, self-medicating, and they'll come to you when the pain is unbearable. So this concept where we are supposed to ask patients, okay, so how much is your pain from 1 to 10? If a man is coming used to come to us in a rural setting, it had to be a 10, because at that point that man is not able to do anything. And I've seen patients who come to us when anybody else, especially not just women, anybody with a lower tolerance level would probably not be walking, and the person walks in and says, okay, so I have this small injury, you tell us what to do. So men are not only shy of going to, not shy, I don't know, they probably avoid going to a doctor, not only for mental health reasons, they even avoid going to a doctor for physical health reasons. They this discrepancy where they have to feel that they are the strongest even while they are in immense pain. They still make sure that their family goes to the doctor first instead of them going. So this is something as a society we need to work on, so that we can make them realize that they're as important as everybody else in the family. It does not have to be, the order does not have to be the kids, the mother, and then the father, or the hierarchy. Everybody needs attention when they actually need it. So that is
Absolutely.
a very, yeah.
So the next question, Dr. Manvi, it is believed that men do not have any kind of hormonal issues. Is it true, or just it's an overlooked instance that men also might have some hormonal
Uh,
issues?
Absolutely, absolutely. This is another overlooked issues. Like, for example, we discussed erectile dysfunction. One common, not common, one another issue, one another reason why people may have this is because they have a reduced amount of testosterone, which can be very easily cured and managed. All they have, matlab, it is so easy to manage. But since people do not come out and talk about it, and this notion has been created that hormonal imbalance is not present in men, is absolutely wrong. In fact, diabetes is caused because of insulin reduced in the body, and insulin is a hormone. And diabetes is more common in men. So, just statistically speaking, men are equally likely to have hormonal issues, and they do get hormonal issues. We just don't talk about the men sexual health issues as much as we do about women, because women's health has always been more important or more pushed to the forefront as compared to men. It is wrong for us to assume that men do not get hormonal imbalances.
A question on the same lines, Dr. Manvi, when we say
Okay.
that, we should always guide women on cervical cancer, or proactively keeping a check and getting their mammography done. On the other hand, we do not guide men about prostate issues. Um, is it something also that we should take care of to actively educate and create awareness about?
Absolutely. Yes, absolutely. Not only prostate cancer, actually, the BPH issue that I said, that is common and it affects almost every other man. And one visit to the doctor, they probably might not even draw your blood. They'll just examine you. If you have BPH, it can be, matlab, they can diagnose it just right there. It is not a very big thing. It is actually easier to diagnose than cervical cancer, and easier than getting pap smears done, as we educate women to get done. Uh, vigorously, we ask every woman we know to get screened for these, right? For men, prostate cancer, diagnosis of prostate cancer is one blood test and one physical examination, and the diagnosis of BPH is one physical examination, and that will prevent you from suffering from the disease, and curing it if caught on time, and just living so much of a better life than you would have if you found it out later, right? The treatment for both of them are also very much possible, safe, easy to be done, and it is one of those cancers and those conditions that, if diagnosed early, have beautiful recovery. Your quality of life improves by manifolds. But because we do not educate men enough about this, they tend to not go to get screened regularly. In fact, for BPH, even though it is less common, but people from the age of 30 to 40 should start getting screened for it. If not annually, then maybe once in 2 years in the 30 to 40 range, and then after that annually. Because one annual checkup, one annual body checkup per year, matlab, just one is going to help out a lot. And
Absolutely.
men should absolutely be encouraged to get screened for them. Yeah.
Right. So with this, we come to an end to today's session. Thank you so much, Dr. Manvi, for making us understand about the importance of men's physical and mental health in the month of November, which is specifically dedicated to men's health. Thank you so much for that. Thank you so much, everyone, for joining the webinar. And I hope you found some useful tips, techniques for keeping a check on your health. If there are still any questions, you can reach out to us via the Xyla application, and we would be really happy to answer any of your questions. Thank you. Please take care.
Thank you.